A Toronto man was infected with HIV earlier this year despite taking a popular medication meant to prevent transmission, and that has sparked conversation nationwide and here in Miami Beach.
I'm someone that never was into condoms, and it was something that I was very ashamed of.
John Bryn is one of thousands of people who relies on Truvada to protect himself from HIV.
If I don't do something, I'm going to be, it's going to happen to me.
A recent report says more than 30,000 people in the U.S. take a pre-exposure prophylaxis drug also known as PrEP like Truvada. For Bryn, it meant he didn't have to use condoms.
Gay men should be treated as adults, and they can make their own choices.
But while on Truvada, Bryn had an HIV scare.
And I thought, oh my God, it doesn't work. And so then I got really, ultimately found out it was a false positive.
Today, Bryn is an advocate for PrEP. He works with the Swallow This campaign, a reinvention of a New York campaign that is turning heads.
It's in your face, but it's still tongue-in-cheek.
Bryn showed me it takes less than 5 seconds to take the medicine, but he still sees resistance from the gay community. Why do you think there's an opposition to PrEP and Truvada in America?
It's terrifying for a lot of people who lived through the 1980s to see, and those are the people who have most concern about PrEP. PrEP addresses a reality, and I think a lot of people are, uncomfortable with the reality.
Hello?
Dr. Amy Wecker, an infectious disease specialist in South Beach, supports condom use, but says taking PrEP is more important.
If you get chlamydia, gonorrhea, syphilis, trichomonas, they can be cured. But so we need to stop the spread of HIV, and so people are not going to use condoms if they don't want to use condoms.
According to the U.S. Census Department, the Miami area leads the nation in HIV and AIDS rates. Dr. Wecker says she wants to fill the void in the South Beach area.
It's very different from down here. There's just a lot of education in place, a lot of programming in place, places that people can go. That this stuff just doesn't exist here.
Not all healthcare providers are as supportive. The AIDS Healthcare Foundation, a nonprofit that serves more than 600,000 patients worldwide, says government money could be better spent elsewhere. In a statement, a spokesperson said in part, quote, "We do not have a blanket opposition to PrEP. Our AHF medical providers prescribe Truvada as PrEP. What AHF is against is deploying PrEP as a community-wide public health prevention strategy. AHF believes this is not a prudent use of resources or prevention funds as a public health intervention." But Dr. Wecker disagrees, saying PrEP is the best available option right now.
People get pregnant on birth control pills too. Does that mean we should stop prescribing them? There is nothing that is going to be 100% effective.
As for Bryn, he's already looking ahead to the future of PrEP and the possibility of going pill-free.
And that would mean you would get a shot every 2 to 3 months, and that would cover you. You wouldn't need to take a pill every day.
Research presented earlier this year shows promising news for an injectable version of PrEP, and companies are eager to get approval soon. Reporting in Miami Beach, I'm Louis Finley.